and welcome to Showtime TV. My name is Ms.Watiri. This is My Health is My Wealth, and we have our guest here, Madam Sharon, who's going to tell us what she does. And our topic today is all about HIV. Remember, HIV is a virus that needs to be talked about once in a while to avoid the stigmatization and also to embrace even those people who are living with it. So stick around, guys. Lakini, in the meantime, let us hear from Sharon and let her tell us what she does, and we can see have another guest here. So the show is about to get interesting, guys. So stick around. Karibu sana, Sharon. Tell us.
Asante. Sharon Watiri Macharia, mentor mother of Magana Health Center in the CCC department. I deal with HIV and I do mentorship to young mothers and also young positive mothers who are breastfeeding. And to be specific, HIV does not kill. What kills? They are the opportunistic infections.
Yeah, exactly. So people would like to understand what you have said about the opportunistic diseases. So maybe you can explain probably what HIV is all about. What does the virus really affect, so that now the opportunistic diseases can come into our body?
Okay, as we all know, and what we learned back in our primary schools and high school, HIV, it's a human immunodeficiency virus.
Yes.
So what it does, when you acquire it, you first acquire. When you acquire it, it suppresses your immune. And when it suppresses your immune, then the opportunistic infection. Hizi ni magonjwa tegemezi, zinangojea immunity yako iende chini kabisa, alafu zianze kuattack.
Yes.
Na hizo magonjwa ama ugonjwa ni kama TB, herpes, oral thrush, skin infections, and sometimes it affects even the brain. So what we do, that is basically HIV, what HIV entails. And when it attacks your body, it suppresses your immunity. So that's where now the mentorship and the education that it's required. So hapo ndipo tuna introduce nini? ARVs.
All right. So do you deal with do you normally deal with mothers only, or you can also deal with other victims of HIV?
Okay, I deal with other victims, but I like dealing with mothers.
Okay, so we put our topic strictly to mothers. Maybe you can mention once in a while we go outside mothers, but I know the people would like to understand HIV with mothers. So tell us the process. For example, a mother goes to the clinic and she's tested positive and she's expectant. So what are the procedures that she undergoes to protect the baby from acquiring HIV and AIDS?
Okay, what we do in our ANC clinic, antenatal clinic, we usually test, and our viewers can confirm that each and every time they visit our clinics, we do testing. And what we encourage is, when the lady is going to the clinic, may she be accompanied by the husband or the babe or the baby daddy, so that we can test both. And when you do the testing, maybe unfortunately we find that the woman is positive, we start sessions, because HIV, it's a disease that huwezi chukulivi hivi, sika homa, and it's a process. So we first do the counseling, and we tell the woman it's not the end of time. And nowadays it's not like the olden days. Ati mtoto atanyonyeshwa, ati like those stigmas around the society, you know them.
Exactly.
So we start. We give the woman the medication. And the mother.
Before you continue, there's a question that probably I would like to ask so that people can understand. All right, so antenatal clinics start as early as probably 2 weeks when a woman learns that they're pregnant. Okay, so if for example a woman comes for probably 6 months, because we understand that there are women out there who would be like, oh, I don't feel like going to the clinic. So after how long is it, how late is it too late for a mother to be at risk of getting HIV and AIDS to transmit?
Okay, it's too late when you've not known your status, and when you have delivered at home, because one thing we know, mtoto ako na damu yake, na uko na damu yako. So we advise go to clinic as early as possible.
How long can it take for the mother to transmit the baby the HIV virus? Can it be like 6 months? Okay, if I come to the clinic and I'm HIV positive and I'm expectant, probably like 6 months, and that's when probably I'm getting my first test for HIV and stuff. So if I'm already infected, could that already be have affected the baby already?
No.
Okay, all right. Okay.
No. The baby in your womb is negative.
Yeah. Until birth.
Until birth, but there is some things that we consider.
Yeah.
We advise the women to give birth at the hospitals because it's safety.
Yeah,
and they're going to take precautions.
Yeah.
Because when they give birth at home or at the road or in the vehicles, the blood will
mix up.
And what we know, transmission of HIV, it's through the blood fluids. And that's blood, semen, vaginal fluids.
What about saliva?
No, saliva does not transmit.
And what if I kiss somebody who is HIV positive and I have a wound in my mouth? Can that really affect me? Can it infect me?
The percentage is very
It's too low. They are very low chances.
Yes,
all right.
They are very low chances.
Okay.
And because of that, now our viewers will ask, and if HIV can't be transmitted through saliva, then why do we use the oral swab?
Yeah.
The oral swab uses the antibodies in your gum.
Oh, okay.
Not the saliva.
Okay.
Because if it's the saliva, maybe you'll be told, spit on your palm.
Yeah.
But you're told to swab it in your gum.
Okay.
Yeah.
So back to our discussion, when the mother now is already HIV positive, they go for counseling.
We give the woman the ARVs and the baby, even if she's or he or she, the baby is in the womb, we give her the baby the prophylaxis. Those are the medications that are supposed to be given to the baby before he or she breastfeeds.
Okay.
Because we understand like even the breast milk can transmit HIV. So the prophylaxis will act as vaccines to the baby. Then let's say the baby has been born. We will take those prophylaxis immediately. And now the nurse will advise the woman or the mother on on the dosage. Then we encourage monthly visits for the mother for correct monitoring for the baby and the mother. At a period of after 6 weeks in breastfeeding, the first clinic, mtoto anaendanga anapimwa and everything, we do the test. We do the HIV test to the baby. A large percent, we notice their status during 6 weeks. And when we notice it, we start.
Sorry? 3 minutes break. Okay,
And when we test, we now know, is the baby positive or negative?
All right.
If the baby is negative, he or she will continue with the medication until when they cease breastfeeding. Gone are the days when we say that this woman is HIV positive due to stigmatization. Now the woman can breastfeed her child comfortably and anything.
And that
won't infect the baby.
Okay, so maybe before we take a break, maybe we can look at the precautions that the midwife is supposed to take when giving. You know, like for example, maybe there's a way they're supposed to handle the baby. If, for example, maybe the midwife, I don't know, are there any precautions that are given to the midwife when she's helping the mother to deliver the baby? Those precautions.
The precautions are don't let the mother's blood contaminate or get into contact with the baby.
Oh, how is that possible?
Okay, it's they know the midwives, they have the skills and they know all the process.
Okay.
So
all right. Okay, I don't know. I think when the baby is being born, they have to get. But okay, maybe there are ways which
but they're experts.
No, they're experts. I'm pretty sure. So good news for mothers. Recently, actually, a HIV positive mother could not breastfeed their baby, but now it is very, very possible for our babies to breastfeed even if we are HIV positive. That's great news, thanks to technology. And then, by the way, 2 positive parents can give birth to a negative child.
Very
possible. All right. Okay, let's take a quick break. And I know people are curious about these. Our guest here, sitting here. We also have other items here. We have condoms here, so we're going to look at that and so much more after the break. I'll see you guys. Okay, welcome to the show. Welcome back to our second segment. I think the last question I asked you is about two couples who are HIV positive. They can deliver a negative child.
Yeah.
So maybe you can explain that.
Okay, they are called concordant couples.
Concordants.
Yes.
Concordant
Couples. Yeah.
Couples.
Concordant couples.
Yeah. It's okay.
So they can give birth to a very negative couple and we
a
have
child.
to a very negative child, and we have stories and cases, and maybe one time we'll host one and they'll tell you the process.
Okay.
What we advise is when you realize you want to get pregnant, go and seek for help and for counseling. How will you do and how will you go about it? Then there's other type of couple which is discordant. A discordant, maybe me, allow me use you as the example.
Yeah, sure.
And disclaimer, we are straight.
Yeah. Yeah.
So,
I can confirm that.
So I'm HIV positive, and you as the man, you're HIV negative.
Yeah.
I will still get a child, and you will be negative, and you remain being negative, as long as I, as the person who is negative, who is positive, I'm taking my ARVs well, and we are taking precautions. And one of the precautions that we usually advise: correct condom use.
Correct condom use.
Correct condom use.
What about the PrEP?
The PrEP and the PEP. Okay, the PrEP it's pre-exposure prophylaxis. When you use it earlier, you know you're going to meet your man or you're going to meet your girl, so you take those pills before.
Okay.
And then during sex and after sex.
Oh really?
Yeah.
How many days before sex?
Oh, okay. Earlier we are taking pills, those pills, until the risk is over. That's what we were saying. Take the pills when the risk is over, because dawa si githeri. So you can't keep taking medication, and the PrEP, our large customer are the commercial sex workers. And you know now for them they'll take daily. Daily. Then there is this event-driven PrEP. We shall talk about it maybe next time. Event-driven PrEP. Yeah, no, event-driven.
You want to go for which one?
Hey, Sharon, I'm a girl, so I want you to meet up. No, it's the man who's telling me.
Okay, whatever. I'm jumping into conclusions. Okay, fine.
It's valid. So for today, let's concentrate on correct condom use.
Sure.
Because it's the topic. Okay, PrEP and PEP is another topic that you can handle for another day or another session, so that we can get to understand what's PrEP, what's PEP, and what's ARV.
Exactly. So. As
we can all see, this is the male sex organ. And one thing, viewers, it's when you want to have to use a condom, one thing you have to do, rule number one, first have it. Huwezi tumia kitu huna.
Always have it in your pocket.
Always have it. And the best person I advocate to be with it, it's the ladies. Because they have their purse. They place their things orderly.
Even that time they are very, very composed. Apart from the man, the man is always in a hurry. Let's do this. So akili yake iko hapo, but a girl can tell you, hey, chill, let's use a condom.
So men out there, usijamia demu yako kimpata ako na condom, anakujali man.
Si ati anaibeba ndio aende huko. It's just because she's just taking break. In fact, it's a good thing if you find your girlfriend with a condom. Doesn't mean she's having sex. You should be happy that at least she's taking care. Even if she's cheating, she's taking care of your kids. Same says he has this and it's blue in color. It's used in birthdays.
The processes of which we go through together.
Sure.
So have one.
Okay.
So you're going to use a condom first.
Guys, please don't get me wrong, okay?
Wasikujudge.
Yeah.
So you will first you have it. Then rule number 2. Check the expiry date.
Yeah. This one is expiring on March 2027, exactly. So it's good enough.
And we are in 2023.
Yeah, that's a long time.
Then the second thing, the third, you press it. How do you feel yours?
It is slippery.
So
it's like sliding.
Yeah. Kuna hewa ndani.
Yeah, na pia kuna hewa ndani.
So it means it's good.
Yeah.
When you press it and you feel like
hakuna hewa,
just don't use it.
Okay.
And when you find it's expired, don't use it.
Yeah.
Now here goes the question. Utairarua aje?
Okay.
Don't start. Like, don't pick anywhere. You see this side, and you now so the serrated part. If that's the correct English, yes.
This one?
No. This.
Oh, the one that has that is wrapped in that. This one.
The rough side.
Yeah,
the rough side.
It
has 2 sides. The smooth one and the rough one.
Yeah.
Then you press it to the sideways. For the ladies, I can see my host here, kuna nails. Don't do this. Don't. Usishike na kucha. Why? Ukishika utairarua na hii ndio kama. It's rubber.
And maybe ndio tu iko man and in the middle of the night.
Night kitu lazima tuifanye. Like chill. The lady, you use this.
Yeah, the part of the fingers.
Yes, this part of the fingers.
I think I'll cut my nails.
You don't have to. So you use them and then you tear.
Yeah. Oh, that's easy.
Yeah, it's very easy. Very easy.
You hide.
Now, here we have it.
You hide this.
Here's our
condom. This has broken many families.
Yeah, here's our condom. And
then you like press it out, eh?
Yeah, you press it out.
Ooh. Yeah, there you go. So, why is yours looking like, okay. So this one is up.
Now this is the question. Which is the right side and which is the wrong side?
Yeah.
So this part, you see the ring part, if we shall go to and we shall place it there. Ile side yenye, okay, inaweza sema aje. Ile side yenye unaona ring inaweza enda chini. That's the correct part. Yeah. This other side, you have the condom but utaiplace vizuri.
Yeah.
So utakuwa na wear and tear. Because you're forcing it to
enter.
Kuingia.
To fit.
Yeah. So you look at this side, then you press. Where are you pressing?
Oh, you press the tip?
Yeah, the tip.
To let the air out.
Okay. To let the air out here.
Then
you place it. You don't place it in any tennis or dick or which.
Yeah, it has to be.
It has to be.
Please don't go for Viagra for it to like just make sure you are hard enough, yeah, right?
Hard and then
usikuwa unaiweka alafu inavonyoka inapeleka.
So you place you place and then you roll it. And you roll.
Yeah, there you go.
Yeah. So this space, the use of this space, it's when you're finished and the guy amemwaga.
Yeah. Has ejaculated.
Has ejaculated.
Yeah.
For that.
You know, people are watching us even from the States, so we have to be a little bit.
So here is the semen.
The semen.
It's here and then kazi kisha. Umaliza kazi. You wrap it. Oh, sorry.
No, show us how they remove, because there are people who remove it and they will mess around. They will do.
Yeah.
Yeah.
Using a tissue Sorry, I never carried mine.
And
that's very wrong. But obvious kwa bedroom ama penye mko kuna tissue. Just use the tissue for them. And I advise the lady should do it. Like the lady, because hii stuff yenye iko juu ni ya lady. See? It's the vaginal fluid from the lady. So the lady can feel very comfortable and aitoe vizuri gently. Saizi ashamaliza kazi. So anaitoa tu. I can just hear some sounds hapo nyuma. Tukasana nyuma ya tent. And I have more. So tuita tu pole pole. Be gentle. Usita juu Emily. And then when you're finished, yangu imetoka ni kama haitaki ama ilikuwa inataka kufanya kazi. Okay. So you wrap it, uko na tissue, you wrap it very well and throw it in a pit latrine.
Not in the toilet. Because it will do some blocking, it will block the toilet. Then don't go throwing it anywhere. You have babies, you have kids. Mom. So you will go and find balloon. Mom, nimepata balloon. I had that incident when I was a child. My mother washed us even using Omo. Oh my God. But it's mother's love. So you wrap it very well, and then if you don't have a dustbin, or if you don't have a pit latrine, wrap it very well, place it in a dustbin. Penye unajua mtu huyo hawezi fikia. Nada akishika hata kuwa anajua ni nini, then throw it away. Okay. After use. So you say I just speak the whole thing, then I use my both fingers, no, you can use. No, first. You press it. Pinch. I pinch it. Pinch, place, then roll. Don't roll it for me. Let me just do it. Okay, so I pinch, then I roll it. Damn, that was easy. Then that's it. That's very easy, guys. And this is it has what are these for? These are it's dotted. Just for the pleasure. It's for the pleasure. Okay. Okay. And it is lubricated. All right. So kuna jakushina kutumia mate. By the way, speak about the use of saliva during sex. By the way, can it make this condom burst? If, for example, the woman is not well lubricated and stuff, can it really burst the condom when the woman is dry? I think it can. Because the saliva, it's not lube. It's not lube. Wait until the woman is well lubricated, so that at least in a sliding. And I know sex that's from. It's in the head. By the way, it's in the head. If the woman is not in the mood, then you cannot. Okay, prepare her very well and make her to be in the mood so that everything runs smoothly. Exactly. And the one news, the best thing about condoms, it prevents us from HIV. It's not unwanted pregnancy. It's unplanned. Unplanned, not unwanted. Unplanned pregnancy. I think unplanned is better than unwanted. Because in this world, no one is unwanted. Exactly. Everybody is wanted. The only thing is that you didn't plan. So it even prevents you from gonorrhea, syphilis, cancer, and many related sexual infections. Cancer, I've heard you talk about cancer. The sexually transmitted disease, and it sounds fatal. Okay, so I think that's great. So we are going in the next session. You're going to talk about how effective is a condom. They say that's not 100%. So you're also going to tell us how effective is it, and does it matter with the size of the man? Because some people would say that some people cannot wear condoms because probably they are smaller in size, or which is we shall look into it. I'll see you on the next episode, guys. So So thank you guys for joining us for this session. So we are about now, how effective is a condom? They say it's not 100%, and does it matter with the size of the man? And also maybe you can touch on the female condom too, although we don't have it today, but maybe you can talk about it.
The female condom.
Yeah.
First of all, like, thank our government, because if there's something that they really give Pila mama heart, they are the condoms. They really facilitate. Even the ones that I had, they're from the government.
Yeah.
Government of Kenya. So they are effective. They are 99.9% effective. Why? And if you want it to be 100% effective, then use it correctly.
Yeah, sure.
Do the PPR. Pinch, place, roll. Then use it correctly. Okay, there are some. Okay, there was that excuse. Oh, the condom is small, the condom is big than the dicks, but this is now a standard
condom. It can fit all sizes.
It can fit all sizes, and it is elastic.
Okay.
Being elastic, it's very effective, and even the thickness, it's advised.
Okay.
The thickness, it's perfect.
All right.
So hakuna mwenye ataweka alafu aseme eti imepast.
Okay.
If it's correctly used.
Yeah, please guys note it, if it's correctly used. Yeah, pinch, press,
place, roll.
Yeah, exactly.
PPR.
You have to pinch it first. Don't go put it in. Okay, so let's talk about the female condom. How effective is it? Better than the male condom? They say that the female condom is better than the male condom.
Yeah.
Or what if the woman uses it and the man uses it?
No. There'll be a lot of conflict.
Okay.
Like, I have the condom and my man has the condom. Like, even you won't enjoy.
Yeah.
So it's advised, use one.
Okay.
Agree with your partner which kind of condom will you use.
You know, there's some people will be like, oh, I had a one night stand, I don't know about this guy, so I just use my condom, he uses his just to be sure. Okay, yeah.
The rubber will
conflict.
Okay. You won't feel it the moment.
Okay.
So the female condom, it has 2 rings. The advantage of the female condom is you can use it more than once.
Oh, the female condom, you can use it more than once.
You can use it more than once. And what we advise, me as the lady, and then he's having the female condom. Next time, guys, I'm going to have the female condom, and I'm going to demonstrate on how it's used. So I will place it. I will get it and I have it in my body for at least 30 minutes earlier. As I said, sex is psychological. Hukujangi ukimerukia mtu and like nipe. So you must have a conversation.
Exactly.
And then the other thing, let your man know you have the condom.
He wouldn't know if you didn't tell him.
Yeah, maybe mnatumia mko kwa giza.
Manze, mko kwa giza that
like, don't do it like that. See your girl, see your man.
Exactly. There's nothing to fear. I mean, if somebody has loved you, let them love you the way you are. Don't mind about your breast, about your stretch marks and stuff. Kama alikupenda venye ulivyo. Kwa hivyo, let's be open while being intimate with each other.
Then the lady holds it. Like now maybe the man would be tough, but I advise for those who have harsh sex or hard sex, let the man use the condom, because maybe in that session it may accidentally get in your vagina.
Oh, it doesn't have like a ring in it.
Yes, it is usually consisted of 2 rings.
Yeah, so for those guys who hit it hard, it's good for the man to have the condom.
You use the male condom.
Yeah.
For those who are they're just tender, they're just soft, they're just good, you can use the female condom. And let your man know you have the condom. Yeah, so that's careful. So that even you can place his organ in the vagina correctly. Yeah, exactly. And after that, anaweza mwaga alafu muende shots ka 3 hivi.
Alafu sasa akisha mwaga, when he ejaculates, do you like clean it using water because of the ejaculation? You clean it using water, or you
clean what?
The condom. You say that the female condom can be reused.
It can be reused, but not sieti uiweke after ametumia utoe alafu weke tena.
Yeah, that's what I'm saying. You can use it, like if I use it today, I can use it tomorrow.
No.
Oh, I thought you said that can be reused.
Yes, it can be reused now. That's one night.
Oh.
Shots tatu.
Okay.
You know, this used once.
Once, okay.
Once you're done, you tupa. Tukienda shot ingine, unachukua ingine.
I thought you said that you're going to go to the sink.
No. Ukiosha kwa sink, the lube.
Yeah, it goes.
Itaisha.
Yeah.
So, for those, for most of the ladies complaining, kitu hapana, na jiki as afanya hivi, to be safe, use the male condom.
Yeah.
And even to be safer, place it.
Yeah. All right. So let's talk about those girls with an allergy. There are people who say, "Oh, I'm allergic to condoms." What are you supposed to do?
Go see your clinician, see your doctor.
Yeah. There's always a solution. Yeah.
There's always a solution.
Okay. All right. Then maybe because I can see my director telling me we have a few minutes remaining, probably can touch on stigmatization before we wind up today's show.
Exactly.
Yeah.
So stigmatization starts from me as the client, as the HIV positive client, to you. So, and what will be your take when I tell you that, you know what, Washera, I am HIV positive? What will be your take? So to end stigma, we are sisi wote ni binadamu, and everybody is prone to HIV.
Yeah.
Everybody is a candidate. So do this as long as you're sexually active. Don't stigmatize a person who is HIV positive. Because kesho yake ujui.
Yeah, anybody can get it. Yeah. You can get into an accident. It's not like an immoral virus, right? It doesn't necessarily mean that this person was immoral. You can get it through other ways. You can get into an accident, then maybe your blood mixes up with somebody who is HIV positive. So everybody is vulnerable to get to it. Yeah.
So the HIV positive clients, let's love them and let's treat them like humans.
Yeah.
They're both humans. They all have feelings. They all want to be loved and to be cherished.
Yeah, exactly. And it's not a death sentence. Then of course, if you're HIV positive, you take care of your health, avoid drugs. I think they also accelerate.
Like every medication, the clinician or the doctor tells you avoid drugs.
Yeah.
Because drugs they distort the functioning of them. And then it's like when you take your ARVs correctly, you're going to blow. And one thing, everybody can view the picture here.
Yeah,
HIV, I can't come and tell you you're HIV positive.
It's not written on.
It's not written on my forehead or anywhere. So let's get tested. Please know your HIV status. If you're HIV positive, please take your ARVs. If you're HIV negative, then take precaution about that.
Yes, that's it. Great. So maybe you can give, that was a parting shot. So maybe you can tell people where they can get you on social media if they want counseling, if they want to visit your offices. Where can they get you on social media? And also you can give out your contacts so that people can reach you.
Okay, Sharon Ateri Macharia. Facebook, if you want to get me, I'm called Shane Macharia. TikTok is Shane Scarlett, and if you want to, we have our facilities, our health facilities where we offer counseling in every public health facility. Just go, say you want to be tested. It's the person who is in charge of patient testing and social work, he or she will help you go through about it. If you want my contacts, it's 0748 926768.
Thank you so much, Sharon. That was a great session, and I hope you guys have enjoyed the show. You've learned about HIV, how to use the condom, because these are some of the things people take for granted. So thank you so much for today. Thank you so much for coming to my show today. I'm so honored to have you as my guest today, and I'm also so honored to have you as my guest. My audience, my awesome audience, thank you so much for supporting Showtime TV, for supporting our shows. Please make sure that you have subscribed and shared to as many people as possible. I've been your host, Washe. I'll see you on the next episode. Take care, guys.